Hey everybody, it's beautiful outside. I'm outside. Um, I was. Oh, first of all, welcome back to Validate with Kate. I kind of want to discuss. I was talking to my therapist recently, and she mentioned how people are being diagnosed and not having their diagnosis explained to them. How that seems to be a common thing, because she's been getting patients in that are just like, oh yeah, I was diagnosed BPD, but I don't know what it is. And she's like, okay. Um, Also, when you hear BPD, borderline personality disorder, you'll hear about it, it's attached to what they call cluster B disorders. Um, and so I just kind of want to take the time to hopefully broaden your understanding or help you out in any kind of way, give you some information that you might not have yet, or just kind of clarify. Um, okay, so first, cluster B disorders. They include they got your histrionic, your narcissistic personality disorder, your antisocial personality disorder, and borderline. Now, a lot of us, I know me personally, when I was diagnosed with borderline and I understood that it was clumped with not only antisocial, but narcissistic. And I just remember like, but I'm none of those, but all it has to do with is, it's all about emotional deregulation. Like, histrionic makes sense. The histrionic is the whole, like, being more emotional, dramatic, on purpose. I mean, it's purposefully dramatic, just so that they get some kind of attention. Like, 4-year-olds are very naturally histrionic. But it's just those people that, they weren't, they, they were dismissed. They were neglected emotionally, and they just don't, it's hard for them to figure out how else to channel that emotion and emote, really. And then borderline is what we're going to talk about. Borderline, just like all the others, is so misunderstood. Just like all the others, it comes with its, what's the word I'm looking for? Words. It's Monday, isn't it? Oh my god, stereotype. Stereotype? Is that what I was? Anyway, okay, so borderline is misunderstood. Okay, I'm gonna throw out the facts. Like, this is according to the DSM-5, the Diagnostic and Statistical Manual for mental disorders. To be diagnosed with any cluster B, the symptoms have to start when the person is adolescent or a young adult. They have to have gone on for over a year if the person is younger than 18. They have to be consistent over time, place, and situation. The symptoms must be distressing. They have to affect the person's well-being. It can't be, the symptoms can't be due to another disorder, not within the cluster B, and they can't be due to an isolated stressful incident. That's PTSD, which is just not quite a personality disorder. But that's a whole other topic. I mean, well, a good way to put it, or the way I understand it, it's like borderline. If you are borderline, there's a high chance that you have PTSD, but not all people with PTSD are borderline. So it's just one of those. But anyway, so borderline, the 9 traits, and I personally had all 9. They are fear of abandonment, unstable relationships, unclear shifting self-image, impulsive self-destructive behaviors, self-harm, extreme emotional swings, explosive anger, feeling suspicious or out of touch with reality. One of my favorite doctors and just people who talk about narcissistic personality disorder and all the other, I mean, psychotherapists, Dr. Romani, she talks with MedCircle a lot. She has her own YouTube channel. But anyway, I like the way she explains it. She describes borderlines as it's more of that infantile need for attention. Like, you don't want attention from everyone. You just want to feel accepted and loved. Like, people know you're there, know you exist, because you struggle so much with your own existence. You don't know who you are. Your personality, I mean, you have no personality. You feel like you have no identity. The fear of abandonment usually stems from something that happened in their childhood. It can be something subtle, just like, you know, being left behind and like getting lost from your parent, or, you know, something that can happen with any child, but it's because of their own personal sensitivity and just, I mean, genetic predisposition, environment, it's all relevant. They all factor in. But, okay, so that fear of abandonment, my personal, I mean, it was something as simple as my brothers are 7 and 11 years older than I am. So, I knew they were there, but they left. I mean, they were just gone. And if they're watching this, it's not your fault. I know, I love you. Anyway, no, like, we have a really good relationship now. But it was just hard for me to understand. And then it was, you know, my sensitivity level is just high. I'm a highly sensitive person. And then that kind of feeds the unstable relationships, is that fear of abandonment. Because you're constantly worrying that whoever you're in a relationship with is gonna get fed up with you and just leave. And which can lead to, you know, that just, it's cause for extreme emotional swings, because it's that cognitive dissonance. It's the cognitive distortions. It's like, like me personally, I knew some of my reactions were uncalled for. Some of my responses were just like, where did that come from? And to myself. And then I'm witnessing this person on the outside getting it, reacting the way they are. And so then I start shaming myself. And that, I mean, it's awful. It's just a horrible demon to deal with. But, you know, the self-harm, it's not always cutting. It's not always what you think it might be. It can be something like they're not eating. It could be something like the no showering. It can look like depression. I mean, it's depression symptoms, basically. It is being a little too quick with the razor in the shower on your legs, not caring if it cuts you. It can be I know me personally, it's just being rough and tumble and getting hurt, not caring what happens to you. You know, just going for it, not using safety precautions for your job of whatever. You know, doing yard work without gloves, doing anything without like eye gear to protect your face. Like, you just don't care what happens. The explosive anger, I wasn't exactly that. Like, I wouldn't fly off the handle for, you know, any reason. It was more just like, it's that buildup of trying to keep the feelings down, and then you just can't handle it anymore. You can't suppress them anymore, and they just all come out. And it's that emotional deregulation. You don't regulate your emotions. You push them down, and then whatever happens, happens. I mean, this is just another reason why DBT is so helpful. And not just for people who struggle with mental illness. I mean, it helps those who don't really have any issues understand more. You know, because you learn the cognitive distortions, you know, of the minimizing the good, catastrophizing the bad for yourself, or even minimizing someone else's bad and then catastrophizing, or like maximizing their accomplishments. Maximizing their accomplishments, which then minimizes your accomplishments. Anyway, like, I'll get more into the cognitive distortions, because I know a lot more people out there probably relate to them. And they're just good to talk about. So yeah, I mean, that's borderline. There's a wonderful campaign going on. I know I've posted videos on my Facebook page, but the I am borderline, hashtag I am borderline. And it's, you know, it just needs more awareness. It needs to be talked about. It needs, you know, it come to light. Just a little more understanding. You know, you hear, normally it's like you hear borderline, and then that's like, oh my god, that's the worst thing you could possibly be diagnosed with, blah blah blah. It's like, no, it sucks. It's rough. There's treatment. It can be diminished, reversed in some cases. It's just all about bringing light to the topic, gaining a better understanding, and knowing you have options, knowing there's treatment, there's DBT, there's EMDR, they're developing a thing called AEDP, which is accelerated experiential, dang it, I can't think of it off the top of my head, but again, that's AEDP. I mean, they're developing so many, like, developing and improving the different therapies that they can use for traumatized people, you know, whether it's BPD, NPD, PTSD, CPTSD, the complex post-traumatic stress disorder. Just keep talking about it, keep getting it out there, keep getting the info out there, have the discussions, and just, again, love yourselves, love each other, support each other. I mean, it is possible to live in peace and be happy, genuinely happy. I can attest to that. If you know me personally, I mean, if you knew me before therapy, I mean, my life has turned a complete 180. And so, alright. Take it easy, y'all. I'll be back with more. But keep the discussions going. I'll talk to you later.